Because of a lack of bed space at hospitals across the country, officials are being forced to cancel or postpone surgeries and other procedures for non-COVID patients. That's led to frustration and additional health concerns.
Tonight, News 8's Shannon Handy shares one San Diego woman's story and her passionate message as this pandemic continues.
The ICU capacity rate in San Diego County right now is at 16%. It's even lower in other parts of the state. For Connie Rim, that lack of space has delayed a crucial surgery, leaving her in constant pain.
I could be better, but I'm doing okay.
Connie Rim spoke with me from her hospital bed at Cedars-Sinai in Los Angeles, where she was supposed to get a surgery designed to cure what's known as a CSF leak, a painful condition brought on by neck surgery nearly 2 years ago.
During the surgery, unfortunately, there was an accident where my dura was nicked. The dura meaning the outer layer that holds in the fluid where your brain and your spinal cord kind of float in.
Connie can't sit or stand without having pain. She spends most days lying down.
I live in a dark room and have earplugs on, and I'm just crying, and I have, a vomit bag sitting next to me because I'm going to be throwing up.
This isn't the first time we've met Connie. In 2012, News 8 profiled her after she donated a kidney to a stranger.
I think about it as if it were my mother or my cousin or my best friend.
8 years later, she's now the one needing help, but because of rising COVID numbers, she can't get it.
They have to convert the area that I was actually in yesterday to accommodate COVID patients for ICU because there's a lack of beds. The chances are I'm not going to be able to have the surgery.
Connie has chronicled her ordeal on a Facebook blog called My CSF Leak Story. On Tuesday, she wrote this post describing her anger and frustration, saying she is the face of so many indirectly impacted by the pandemic.
I see a lot of people that don't social distance. They don't wear their mask, and they have this attitude like, it's not going to happen to me. COVID doesn't exist, or if I do get it, I can beat it. But what they don't realize is, people that do get sick and that were careless, they're taking up beds that other people, and obviously myself included, need.
Connie's message: take all the precautions you can, if not for yourself and for family, friends, people like her, and healthcare workers.
The people that were helping me were telling me they're shutting it down and they're going to be reassigned to COVID patients, and they're scared to death. And that's what I mean. It's a snowball effect of somebody who doesn't take precautions. It affects everybody.
Cedars-Sinai specializes in Connie's condition, which is why she's there. She had this surgery planned for months, but right now has no idea when it will happen.
An interesting point there, and it's sort of a simplified saying, but it's not all about you really applies here.
Yeah, and the beds that are occupied in San Diego County right now, about a quarter of all beds are COVID patients right now. The number's staggering.
It's terrible.